Measles, also known as rubeola, is a highly contagious infection caused by the measles virus. The measles virus is an enveloped, non-segmented negative-sense RNA virus. It belongs to the paramyxoviridae family of viruses. It's spread by respiratory droplets and can remain airborne for up to 2 hours. Because of this, a patient can contract measles by entering a room long after an infected person has already exited. It typically infects the host via inhalation of the virus, but can also enter through direct contact with a mucosal surface, such as touching the mouth or eyes. Once in the respiratory tract, it infects and replicates locally within resident immune cells, such as alveolar macrophages and dendritic cells. As the infection continues, the virus spreads to regional lymph nodes and then disseminates in the bloodstream to other organs, including the central nervous system, conjunctiva, respiratory tract, skin, and gastrointestinal system. Clinically, the infection is divided into several stages. First is the incubation stage, during which the patient is asymptomatic. This usually lasts about 6 to 21 days. Next is the prodrome. In this stage, patients develop a high fever, as well as the 3 C's of measles, which are cough, conjunctivitis, and coryza, or a runny nose. These symptoms generally last 2 to 4 days. During this time, some patients will also have small white spots on the buccal mucosa opposite the molars. These are called Koplik spots, and if present, are pathognomonic for measles. The next stage is the exanthem. A couple days after the start of the prodrome, patients develop a characteristic rash that starts on the face and then gradually spreads to the trunk and extremities, sparing the palms and soles. The rash is red, maculopapular, and blanches or fades with pressure. It typically lasts 6 to 7 days. The final stage is the recovery period. Most symptoms resolve within 7 to 10 days. However, the cough may persist for a few weeks. Throughout the course of infection, patients are most contagious from the end of the incubation stage through the exanthem stage, usually about 5 days before and after the onset of the rash. The diagnosis is often suspected based on the characteristic symptoms, especially if the patient is in a region with outbreaks and lacks prior immunity. It can be confirmed with laboratory tests such as serology, viral culture, or PCR. Patients with suspected or confirmed measles should be isolated and placed on airborne precautions. Treatment usually involves supportive care, including fluids and antipyretic medications. Children with measles, especially those with severe disease, may also receive vitamin A. This is because vitamin A deficiency is associated with an increased risk of morbidity and mortality, particularly in young children. Overall, about 30% of patients will have at least one measles-related complication. The patients at highest risk include those who are immunocompromised, very young, elderly, pregnant, or vitamin A deficient. Because so many different organ systems can be affected by the virus, there are a variety of potential complications, including diarrhea, the most common complication, and pneumonia, the most common cause of measles-associated pediatric deaths. There are also several potential neurologic complications that can occur. The first is encephalitis, which typically occurs within a few days of the rash and presents with fever, seizures, focal neurologic deficits, and irritability. Next, acute disseminated encephalomyelitis, which occurs during the recovery period, likely represents an autoimmune response following the infection. Patients may have fever, altered mental status, and signs of myelitis, like extremity weakness and ataxia. Third, subacute sclerosing panencephalitis is a rare but fatal condition that develops 7 to 10 years following the infection. It's thought to be caused by a form of measles virus that continues to replicate intracellularly within neurons and oligodendrocytes, resulting in a persistent infection that evades the immune system. The symptoms begin with behavioral changes that worsen over time, followed by myoclonus and progressive neurological deterioration. Finally, a significant complication of measles is that it can suppress the immune system against other pathogens like adenovirus or Staph aureus, leading to secondary infections. This immunosuppression can last for years. The most effective strategy for preventing measles and controlling outbreaks is vaccination. The live attenuated vaccine is typically given as 2 doses at ages 1 and 4 and provides protection in about 95% of patients. Adequate vaccination rates in the community can also provide protection to those who are unvaccinated via herd immunity. To sum up, here are the key points to remember. Measles, also known as rubeola, is a highly contagious infection caused by the measles virus. The illness begins with a prodrome of fever, cough, conjunctivitis, and coryza, followed by a characteristic maculopapular rash. Koplik spots, if present, are pathognomonic. Complications can include diarrhea, pneumonia, immunosuppression, and neurologic disorders, such as subacute sclerosing panencephalitis. Treatment generally involves supportive care. Children may also receive vitamin A supplementation. In uncomplicated cases with appropriate supportive care management, measles is typically self-limiting. The most effective strategy for preventing measles and controlling outbreaks is vaccination.